Hey y'all, it's Charles, administrator with Charlin Health Services. If you've been rocking with us for a while on the YouTube channel, thanks for being here. This series is a series where we kind of talk about the history of our company. Partnered with Wheelhouse DMG and did an amazing talk with Aaron and really walked through about who we are, how we do things in our culture. And so if you're interested in learning more about Charlin Health Services, this is a great series. This is the first series where we kind of dive into specifically what hospice is and what it really means in our approach to building a legacy for a long time. So enjoy this first series of Charlin Health Services Digital Wheelhouse DMG meeting with Aaron. I couldn't read the script, sorry, but here it is. The goal is that Charlin is a place where their mom and dad can be taken care of at any stage in life. When you're talking about hospitality, it's about the intentionality of how do you take care of people. Just being respectful of all different cultures, races, and whatever it may be. It's you're a human being. We're going to take good care of you, and that's good hospitality.
That's Charles Bryce, CEO of Charlin Health Services, a family-owned, faith-based hospice care agency based in Texas. Speaking with Charles was a privilege and really a joy. It was so clear from the conversation that the power and the sanctity of relationships are everything to Charles. Relationships with the patients they serve, with the families of those patients, with the team at Charlin, a team that includes his mother, who founded Charlin 20 years ago, and his wife, who is a nurse and works with him to continue to run the company today. It's also clear that Charles remains committed to and connected with the mission that animates Charlin. Really a mission that is about serving others and, believe it or not, bringing joy to what otherwise can be a somber and obviously very stressful period in people's lives. We're doing something different on the Digital Clinic this week. You won't want to miss this episode of the Digital Clinic.
Let's sort of start at the beginning. It sounds like you've got a really interesting background, an interesting history that led you into this business. I'd love to hear about that background and hear about Charlin Health Services.
Yeah, no, it's a crazy background. Yeah, I mean, I grew up in Dallas, Texas, and of an immigrant household. My parents from Nigeria, and everything when I was a kid, they always said, not just them, but just Nigerians in general are huge for like being a doctor or a lawyer or, that's just kind of the big thing. And so, but when I was a kid, I always wanted to be a doctor, just wanted to help people. And so that was like my heart. And so as I got older, my parents actually started a home health company. And my mom's desire for that was to start a home health company where she could basically pass it on to her two boys, myself and my brother. And she was a nurse. And so she saw that at that time, the healthcare or company or the healthcare system at that time was transitioning to a lot of private equity, and it was changing the way patients were taken care of. And she was like, I want to start something where I can hand it off to my boys and they could continue to do a good job. And so it started literally in our like living room. My mom would go see patients and then she would come home and chart paper, and I would come 13-year-old shred paper in the living room, eat dinner, and that was just kind of how it kind of started. I never really thought I would be working in the industry as I got older, but yeah, that's literally how it started. And went to school in St. Louis, did physical therapy, played soccer, loved soccer, and found my way coming back here in 2016. And my mom called me. And she was like, hey, I'm tired. I need your help. And I was like, ooh. Me and my wife, we were like, I don't know. We prayed about it. We were like, all right. So I came back, got thrown into it, didn't know anything. My background is physical therapy, worked at a regional hospital in St. Louis, enjoyed it, loved it. And so going from bedside to now administration was a big change. And then kind of trying to understand how do you scale in a way that's healthy for patients and healthy for, the organization.
We also have seen private equity entrance into
Yeah.
hospice services
Yeah.
or retirement care. What's the difference in the mission of Charlin Health Services versus larger PE-backed hospice services or retirement communities?
Yeah, I think when you look at healthcare as a whole, for us, it's more legacy driven. So we're looking to be a staple in the area for generations to come, God willing, right? So when you're looking at a lot of PE and private back companies, there's always an exit strategy, and rightfully so, right? You're investing $1, you want to get 10 back on that dollar. And so a lot of times when what we've seen in Dallas is that this area is so saturated that the community needs consistency. So what we've done at Charlotte is tried to develop the knowledge and the mindset of what private equity does, but at the same time use it in a healthy way for patient care. And so utilizing the same skill sets and the same mentality, but at the same time focusing on how do we focus on taking care of patients and do it for a long time. So I think for me, I've seen it for the last 8 years. Just study the industry, study the market, study different companies, and I'm like, okay, they did that well. Why did they not do well? Oh, because they sold, and when they sold, a whole new change in culture came, a whole new change in administration came. The patients got taken advantage as if they're like just a number and not really a patient. And so I think with healthcare, like this is just my opinion, but like when you see like a car dealership or you see a product and services industry that doesn't deal with human beings, it's kind of difficult because it's these are people that we're talking about, and especially with home health and hospice, they're vulnerable states, so it's very hard to kind of get your ROI on a human being, and so we try to take that and figure out how do we take care of patients for a long time.
Can you give us a sense of scale?
Mm,
Uh, what are the operations of Charlin Health Services? How many facilities? What sort of patients do you look after?
yeah.
Give us an operational sense.
Yeah. So we serve every year in the Dallas Metroplex, right around 600 patients. So that varies between home health to hospice to veteran services. We have about 55 W-2 employees, and then we do like contract staff, which is contract therapists, contract occupational therapists, contract doctors, and nurse practitioners. So, we're not, the massive companies that you see, but our goal is to slowly and surely over a long period of time grow and help those providers have good stability. So yeah, we service about 600 a year. From that aspect, we just create those relationships with doctors and grow from there. Come alongside them and help them.
Can you describe for anyone listening who may not know what hospice care is, what
Yeah.
home health care is, and in what context you're providing home health care?
Let's break down home health because I feel like it's more easier to talk to when we're talking about home health with families. It's like, oh yeah, home health, let's get better. And so, home health, home health is there's different types of home health, and people see home health as like home care or home health care or homemaker services. But when you're looking at a Medicare certified agency, it's services that are provided in the comfort of a patient's home who has Medicare, right? And so, there's criteria that's needed. So, say for instance, you have a loved one who's weak and has been falling, or who just got out of the hospital who had a heart replacement or a heart valve stent. They need acute care. And so that's where home health comes. And it's usually about anywhere between 60 days to 120 days. And your primary care physician is the one who oversees that and allows for the services, the home health nurse, the PT, the OT, the speech therapist to come in and take care of them. And so, that's where home health comes in. And it's not there forever, but it is there to help. The goal is to help get that loved one back to what they used to do, playing pickleball, like, or just like, hanging out with the grandkids. You had a knee replacement. Okay, I'm gonna be down for about 6 to 8 weeks. Home health is there to help build that back up to prevent infection, to prevent hospitalizations and such. So it's a beautiful system. If it's done well, it's a great help for families. And but that's kind of home health in a nutshell.
What's the advantage in that sort of a context of home health care versus needing to go in for an appointment, being seen at a physician's office or at a hospital?
So when you're looking at home health, it's actually a they're they're combined together to be like a help for the family. So when you're going to see your doctor, the doctor only sees you, once every 6 months maybe. But home health, if there's a need, your home health nurse seeing you maybe one time a week, two times a week, the therapist one time a week, two times a week. So the home health is made to be an extension of care for that primary care physician. And so it is a good thing. It's more of like an extension of care for the services that are needed. So we work hand in hand with the doctor between those 6-month visits or even 3-month visits. And then that's where home health kind of works and coordinates with the doctor, medication refills, changes in things. And then the home health nurse will report back to the doctor and what they're seeing in the home because a lot of times seniors or anyone who's under home health, it's hard for them to go see the doctor. So
And then hospice care.
yeah, hospice is a scary word. Like I think I was joking around with when JT was like, you don't want to use hospice at like a birthday party. Like you don't want to just say like, oh, we're having fun, we're hanging out. Oh yeah, my mom's on hospice. You're like, like it's just not. It's not.
Yeah,
It's
that
hard.
brings the vibe
It
down
it
fast.
brings it down fast. But I think when you look at hospice, it's created by Medicare as a resource and a benefit for Medicare beneficiaries. And really and truly, when you're looking at birth and death, there's value. That's just always going to happen. Someone's going to be born and someone's going to pass away. And the healthcare system is meant to kind of wrap around the families during those two times, right? When you have someone who's pregnant and is about to give birth, you see everyone coming around them and helping them through that process. It's the same when it comes to hospice care and end of life. And that's where Medicare does justice and does a good job to help families through that process if it's done well. And so when someone says, they potentially need hospice, there's the Medicare deems that, 6 months or less to live. An order must be written by a doctor to say, I think you have 6 months or less to live based off of what I'm seeing. Nobody knows. Nobody's like in control of that. It's just the observation clinically of what they see. So the doctor will say, hey, um, go ahead and let's do an evaluation for hospice care. They'll write an order, send it over to the hospice company. The hospice will send a nurse out to evaluate based on the diagnoses and all the diseases that's going on with the patient. And then from there, say, okay, I think you do qualify for hospice. And so when you start hospice, it's basically like the hospice becomes your hospital at home. So you really don't go to the hospital anymore. Hospice comes to you. You don't go to all your doctors anymore. Hospice is your doctor because there's a doctor who oversees that hospice, and that's how they coordinate with all of the medications, DME, prescriptions, supplies, everything that's needed. It's the goal now is to keep mom, dad, uncle, aunt safe at home, comfortable, and now it's a huge support for the family. If they have questions, they have a nurse on call that they can talk to at any moment in time. And then literally that hospice team is there to guide them through all the way to the end. And you don't have to do it alone. It's a good support. So,
For a family going through that process, um, you've described a relationship that sounds fairly intimate
mm,
and fairly frequent.
yeah.
Is that a process in which the nurse, well, first of all, is there one nurse who
Hmm.
is the primary caregiver? And second, how intimate, how frequent is that relationship? Is this someone who is assigned to maybe one or two or three families only,
Yeah.
and their involvement is intensive, or is it more periodic?
Yeah, I think it's a tailored approach. I think that's the best way to say it is, when you have someone who's on hospice, you usually have a primary case manager nurse, but then that nurse usually has an on-call team to help support the nurse so that the nurse isn't fatigued, right? So because that one nurse usually there's a National Hospice Association usually says one nurse should see anywhere between 11 to 12, 13 patients. That should be their caseload, right? And so when you have that, it could be emotionally fatigued. It can be, it's a lot for the nurse. So you have an on-call team that helps support the nurse after hours. And so usually families will have one nurse or two nurses. But when it's after hours, there is a team that kind of picks up that load for making sure they're supported. But they're given report. from that nurse to make sure that they're aware of what's happening with that loved one. And so when you have those together, that team is there to kind of wrap around that family. And then the frequency is, it could be 1 time a week, could be 2 times a week, it could be daily based off of how that loved one is progressing with their disease process. So, it's a beautiful tailored approach. That's kind of the best way we say it, is you tailor towards the patient, the family, because some patients are like, no, we're good. We have my nephew's here down the street. He comes in and checks on mom, just come in like once a week. Or there's some that they have no help. And then, okay, yeah, we need to be there more than twice a week. We need to have our aide come out and help more. We need to have the nurse come out and help more because the family needs the support. So it's every family is not the same, and every family dynamic is not the same either, as well. So yeah, it's a great question. Hey, this is Charles with Charlin Health Services. Hope you enjoyed the video. Please remember to like and subscribe. We hope this was a blessing to you, your family, your loved ones, all your friends. Share it. And if you want to watch more videos, here they are. Enjoy, and we'll see you guys next time. Peace.